evening. Welcome to Soundhealth on Lagos Television. I am Olasumbo Modupe. Nigeria allocated about 1.17 trillion naira to the health sector out of the 20.7 trillion naira in the year 2023 budget, the highest so far. Today on the program, we are taking a look at how Nigeria can enhance performance in the health sector. Good evening once again, and the conversation begins after this break. Please stay tuned. Soundhealth on Lagos Television. Joining us via Zoom this evening is Dr. Jamiu Ganiyu, a consultant public health physician, and he is going to share his thoughts on how Nigeria can scale up performance in the health sector. Good evening, Dr. Ganiyu, and thanks for joining us.
Thank you very much for being with you this evening.
Dr. Ganiyu, before we look at the year 2023 budget and the health sector, how did Nigeria fare in year 2022?
I would like to say that just mere sharing my opinion may not give an objective assessment of how actually we performed in the year 2022, because for us to actually get the actual and to be able to assess it objectively, it will require a kind of evaluation or a kind of situational analysis, of which I don't think such is available, because every year we plan, we have our targets, and we measure it at the end of the day to see how far we've gone. Without measuring it with baseline, we may not be able to have an objective assessment of how we've actually performed. However, based on my own opinion, I want to say that looking at some of the challenges we actually witnessed during the year, most especially the COVID-19 pandemic, I would say we've remarkably done well, talking averagely, right? Not actually fantastic, because you could see we're able to achieve a kind of a reduction in community transmission, and also which is being, witnessed by the current minimal number of cases and a reduction in mortality. And also looking at the initial time, there was that hesitancy in taking the vaccine. But as you can see, we'll be able to record about over 50 million people now have been fully vaccinated, which is actually a good result to talk about when talking about COVID-19 pandemic. Also, the capacity of many state governments have been built regarding epidemic preparedness and response, and that is why we've just been hearing about cholera outbreak, measles, mpox, but it has not actually overwhelmed us because the capacity has been built at all levels, and that is why we'll be able to achieve some remarkable results in that aspect. However, what actually determines the performance of the health sector in any country has to do with some health indices like the maternal mortality ratio, the infant mortality, and under 5 mortality, which actually are a kind of raw measure of progress made as regards to health interventions at a particular time. So at moments, our health indices are not really something to write home about. Nigeria is still one of the countries with high maternal mortality ratio, likewise infant and under 5 mortality rate. So we still have a long way to go. And again, looking at our SDGs, the 17 SDG Sustainable Development Goals, I don't think we've really done very well in trying to achieve that target by the year 2030. Thank you.
What do you think we could have done differently in year 2022?
For instance, there is room for improvement. I'm just particular about epidemic preparedness and response. Why I said that really is because in health, I don't think any system can talk about being 100%. There is room for improvement in terms of we need to continue to build the capacity of our health workforce. We need also to upgrade our infrastructure. We need to scale up all the basic and essential infrastructures at all levels, from the primary, secondary, and tertiary. And what I mean by that is that looking at the idea of universal health coverage, which we are hoping that we'll be able to meet that target by the year 2030, you find that we are still lacking behind. Majority of our primary care centers are nothing to write home about in terms of human resource, in terms of infrastructural upgrading, in terms of even access, financial and physical access to care and treatment is still a major challenge. And that is on one side, and which is very, very critical, because issue of epidemic preparedness and response is one of the come and go. But how about the routine healthcare delivery? We are still lacking there. Issue of healthcare finance is still an issue. How many people have access to what is the coverage of our national health insurance scheme? If at state and national level, we find that the coverage is less than 10%, which means the idea of achieving universal health coverage may not be achievable based on the rate at which we are going in the country. So there are really a lot of issues, but as I've said, every country has prioritized their problem, and I think we may not be able to solve everything at a time, but we have to just take those ones that are of higher priority and try to see how we can address them. Thank you.
Okay, Dr. Ganiyu, let's look at the 2023 allocation, the budgetary allocation. About 1.17 trillion naira has been allocated to the health sector. Experts say this is the highest so far when compared to other years. Do you think our problem actually is spending or allocation of these budgets?
I want to believe that both allocation and release. One thing is budgetary allocation is quite different from release. And I want to believe that has been our problem. You may budget 1 billion, at the end of the day, what is the percentage that is being released? And that is one thing we have to look at one side, at one end. And also, we have to also consider the issue of transparency and accountability. You'll just be hearing BB figures. Are those figures actually reflecting the current realities? So these are some of the things. Maybe we have to have a kind of check and balances on how we ensure, even when these budgets are being released, are they properly managed? How do we, cover the loose ends, loopholes here and there to ensure that the real people that need these services are actually accessing them and are getting those services?
This budget allocation is the highest so far, but it still fails to meet the African Union 15% spending on health sector.
What I need to say is that we'll continue to have gaps in terms of meeting our expectations, in terms of meeting our targets, in terms of service provision, in terms of infrastructural upgrade, in terms of procurement to meet the need of the people. And as long as we continue to have year in, year out, in terms of budgetary gaps, we'll continue our desire to achieve sustainable development goal by the year 2030 will be a mirage. Will not be achievable at all. And it's a cumulative thing, not just for the year 2022. It has been year in, year out, whereby we hardly meet our budgetary the target for in terms of budget are never met at all. And that is why it is showing in every aspect of our health system, especially when you go to most of our primary care centers, some are not in the proper shape, and that has been coupled with the fact that we're having increase in population. it is expected that looking at the way our population is expanding, our budget should be planned in such a way as to accommodate that. But as long as that continues to be that gap, there may be that difficulty in actually achieving all available target that the country set as regard to the health sector.
What are the key areas you would love government to prioritize in year 2023?
This is the primary healthcare system, because that has formed the cornerstone for achieving universal health coverage. Now we need to, put our health centers in proper shape. We need, in terms of human resource, we are not saying all doctors must be in primary care center, at least a midwife, a nurse, at least minimum, with other healthcare workers, all to be at that point. They need to have all the basic infrastructure that are required to take care of their patient. Or another thing we need to, apart from infrastructure development, security, and many other things. Our healthcare must be a model so that the community around can easily get access to that. And apart from, putting our primary care centers in proper shape, we need to also strengthen referral system across the continuum of care. That is, in terms of linking primary care center to secondary and to tertiary facility. Through that process, we're able to kind of reduce the increase in both morbidity and mortality that's been recorded, as I've mentioned, with regards to the high maternal mortality ratio in Nigeria and on the 5 mortality ratio. So we must start by ensuring that we put our primary care center in proper shape in terms of all the basic things that are needed. There are minimum package that are required at that level. We must ensure we have that, because the PAC serve as the contact, the facility that had direct contact with the people at the community level.
One major problem the health sector is facing now is the brain drain syndrome. How do you think we can achieve health workers retention?
Well, we are really concerned with that, but not that it has not been existent before now. It's just that of recent it became a kind of a bigger concern. And I think the only way we can do, as you can see, is to provide that enabling environment. There are a lot of things that have gone wrong in the country. If you look at, we have this healthcare worker interprofessional rivalry has been an issue. Looking at issue of take-home packages, salary, maybe it has not been is not really encouraging. Maybe consider what the healthcare worker offered, it does not measure up with what they take at the end of the day. So, and again, another thing is that we need to motivate healthcare workers. That is making sure that they have the allowances is something that can commensurate with what they are doing. So in terms of motivation is very, very key. The enabling environment is very important. Security, if I start naming many things that we think they need to be put in proper, put in order so as to, reduce this, it will not be able to finish this interview. But I will just mention that some have left because of insecurity. Government need to ensure that there is proper security in the country. Some have been kidnapped, a lot of issues. Issue of, as I've said, the salary is not something we need to, I'm happy government is trying to look at that. We need to look at our salary, considering the current economy meltdown. People, we need issue of salary to look upon. As I also mentioned, that being a long battle between doctors and other healthcare, that must be harmony. Try to make sure that there is peace in the healthcare system. Even the environment where we work is also very important. If you look at some consulting rooms at times, there are nothing to talk about. There are something that they're in a sorry state, and I don't think that really work out. And apart from even that, we need also basic amenities is also very important. If you want a doctor to work at PAC level, you need to make provision for accommodation. You need to make provision for electricity. You need to make provision for water and other basic amenities so that the person will feel that sense of belonging, not that people are being, health workers are being treated as if considering what they pass through. So there is a lot of things that actually need to be put in place so as to reduce this. And there must be that general assurance by the government. Not that, look at, for in the last 1 year, how many times did resident doctors went on strike and another healthcare? So you find that it's really not really encouraging. So I cannot offer all the solutions there, but I think all the major stakeholders need to come on board, sit down, deliberate, look at what are the gray areas, what are the challenges, and through that, there should be a kind of collective way, a collective approach on how we are going to actually, provide appropriate solution to this current brain drain. Thank you.
What is one big win for the health sector that you're rooting for in year 2023?
The one big win here is the fact that we should try to, the global health should be so resilient, robust to be able to, respond to any emergency or any threat to global health, which we're able to do, like with this, with what happened with the COVID-19 pandemic. At least the global health has shown that despite the challenges, they'll be able to show that capacity, as shown by the urgency at which those vaccines were the COVID-19 pandemic were produced, and now we've been able to control it, considering the associated morbidity and mortality associated with the virus. Yes.
As we wrap up now, let's have your call to action.
Yeah, our call to action is, as I've said, we keep on building on our current achievements and try to, and you see, one thing is that for you to talk about what should be the next, you need to first look at what is at the moment, kind of situation analysis or rapid, a kind of analysis to look at where are we today, and try to say, okay, that will now form the need for future plan in terms of which areas, especially the concern with the emerging and re-emerging diseases, they are gradually becoming a global threat. And we also try to look at how those areas can be looked upon. And through that process, the major stakeholder, especially WHO, can, with other stakeholders, can look at how we can function a better future at the global level. Thank you.
Thank you so much, Dr. Jamiu Ganiyu, consultant public health physician, on how to enhance performance in the health sector for year 2023. Sound Health continues with trending health report from around the world. Please stay tuned. Enjoy the program so far. It's been an eye-opening session with Dr. Jamiu Ganiyu, the consultant public health physician to play your own part by ensuring you adhere strictly to all precautionary measures so we can achieve a preventable healthcare sector in year 2023. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at TLTV Social #Soundhealth. A sound health is a sound mind. Make healthy living your choice.